views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello, everyone, and welcome to a web exclusive of Perspectives. I am Darren Hyman. We want to thank you for watching. Our topic of discussion right now, we are discussing the bill that's making its way in Washington, D.C. about the American Health Care Act, how it exactly affects us and what the ramifications are, all of that. So our guest in studio, you can catch her on Open. You've seen her on Open. You've seen her on Perspectives, and she's here for this web exclusive, Abby Udochi, and she's going to give us a little bit about this Health Care Act and what it actually means. And so, Abby, first of all, thanks for coming and sharing with us on this web exclusive.
Sure, it's my pleasure, really,
Good.
to be here with you, so thank you.
A lot of tension,
Yeah.
a lot of apprehension.
Yeah.
What should people know?
They should know that the American Health Care Act is a bill. It is not yet law of the land. The Affordable Health Care Act, or the Affordable Care Act, or the ACA, commonly known as Obamacare, is currently the law of the land.
And still the law of the land.
And still of the law of the land. So there is an effort to repeal and replace Obamacare, but that has not happened yet. Mm-hmm. So people should keep their coverage, and as long as they're able to access coverage, they should continue to do so. That's a really important message.
Right.
You don't want to lose your coverage at this point. If you have access to it, keep it. If you need to enroll, go ahead and enroll. The open enrollment period begins on November 1 of this year, so go ahead and get on New York State's marketplace and enroll in health coverage if you don't have it right now.
And important for people to also understand that the bill currently right now has passed through the House, making its way to the Senate, but the Senate is going to put its own revisions to it.
That's correct, yes. So on May 4th, the House of Representatives of the Congress voted to pass the American Health Care Act, and it is now with the Senate, and the Senate is developing some revisions and their own version of that bill. Once that happens, the Senate will have to pass their version of the bill, and then it will have to go back to the House. And the House will either vote to pass it, and it'll move on to the President for his signature, or they will make their own markups. Or two of the houses, both the Senate and the House of Representatives, could come together and decide collectively what's going to move forward to the President once it passes both sides of the House. So there's still a lot that needs to happen.
For people who are on Medicare, a lot of concern about that because Medicare adversely affected if this bill makes it through.
Yeah, so there are three programs that people should really understand that are impacted by this bill. So Medicaid, the Qualified Health Plan or the Marketplace product, and a product called the Essential Plan, which frankly only 2 states in the country have opted into. The Essential Plan right now covers 665,000 New Yorkers. And it's a really great product. About 50% of the people who are in the Essential Plan don't pay any premium at all, and another 50% pay about $20 a month. It's got a really nice benefit package, and it's an affordable option for people who make too much to be in a Medicaid managed care program. Now in New York, though, there are 4.3 million people who are enrolled in Medicaid managed care around the state of New York. In the Bronx, there's 612,000 who are enrolled in Medicaid managed care. So between the Bronx, Medicaid managed care, the Essential Plan, and the Qualified Health Plan, there are about 700,000 people who live in the Bronx who will be impacted by the decisions that our legislators will make around health care reform. And that's 50% of the population of the Bronx.
You know, that's a major number.
Yes.
Also, Child Health Plus.
Yes.
A big component of this bill. How could that play out?
So Child Health Plus right now has its own appropriation. So what that means is that it sits outside of the American Health Care Act, but the way that it will be impacted really is through President Trump's budget that was released last week. And he is proposing to cut spending for Child Health Plus over a period of time by about 20%. And that's going to impact 8.9 million children across the country. And in New York State, in the Bronx, it'll impact about 17,000 children.
Wow, major. Pre-existing conditions, also a topic of concern.
Yes. So pre-existing conditions has been well debated over the last several months, several weeks. People probably have heard enough about pre-existing conditions. We all likely have a pre-existing condition of some kind. But the question really is are pre-existing conditions covered within the AHCA? And the short answer is yes. But the way that it's covered is what people should really understand so that they can make the appropriate choices for themselves. So again, the AHCA is a bill. So the pre-existing conditions provision is a proposal. And the proposal is that if you have a pre-existing condition and you should lose your coverage and you're not able to get it back within a particular time frame, which is 63 days, if you receive new coverage after you were disenrolled on the 64th day, your plan will have under the AHCA, will have the ability or permission to evaluate you based on your condition, your health condition, and your medical expense, and then come up with a premium for you that will be different from the premium and higher than the premium you were paying before you were disenrolled. So the plan will have the right to charge you more if you have a pre-existing condition, if you should lose your coverage outside of that 63-day window. The same provision exists for people who don't have pre-existing conditions, and that really is about an incentive for people to keep their coverage, is what it's called. It's called an incentive. So if you don't have a pre-existing condition and you lose your coverage, you don't gain it back within the 63-day window, your plan under the AHCA will have the right to charge you 30% higher premium for the remainder of the plan year. You'll be eligible for a lower premium once the plan year turns and you reapply for the following year. If you have a pre-existing condition and you are faced with a higher premium, you'll have to pay that higher premium for a 12-month period of time until you're eligible for a lower premium a year later.
So for people who are out there, obviously this bill is still making its way through.
Yes.
You want to get connected to your elected official because for those who are here in the Bronx, we know that's a major number, and you want them to get involved. So I know you got some acronyms here, so what do you call them?
Yeah, so it's important that people get educated, that they evaluate the options and the proposals in the bill, and they get engaged. I call them the 3 E's.
The triple E plan.
The triple E plan,
there you go.
right. So education, evaluation, and engagement is really important. And I say that because it really does make a difference. You know, one man, one vote is true. And everyone has a voice and has an opportunity to use it. And I think in this case, time is our friend. And we should use that time and we should use our vote to understand what the issues are that face us, face the coverage that we can access for ourselves and our families, and call our elected officials and let them know what we think. Whether we're in favor or we're opposed, they should at least know what the people in their district think. So if you're interested in knowing who your elected official is, all you have to do is go to the State Board of Elections website, which is elections.ny.gov. I think it's on the screen. And there's a button on the homepage that says find your elected official. You type in your zip code and up will pop every person who represents you on every level in New York State.
And you should get all the information there and then getting engaged. The simple thought about making a phone call, making your voice heard, some people are against that. Oh, my voice doesn't matter, my voice doesn't count. You say what?
I say that it really does. I say take a lesson from the people who rallied and attended town hall meetings that their members of Congress held prior to this bill being passed. It really made a difference in the ways that elected officials were thinking about the decisions that were being made and the conversations that were in front of them. So we all know that people want to please the folks that they work for, and our elected officials work for the people who live in their districts. So it's important that folks understand that and exercise their right to at least have a conversation and make sure that people know what they think, either side of the aisle.
Abby Udochi is here with us, and she is the Senior Vice President of Government Affairs and Healthcare Policy over at Affinity. And you've been sharing a lot with us lately. And give us a little bit about the work that you do.
So Affinity has been in existence for 30 years. It is a community-based, not-for-profit health plan founded by federally qualified health centers. And these are health centers that work in low-income neighborhoods, that serve people who don't have access to health coverage, that serve people no matter the income, because they believe that's the right thing to do. Those are the organizations that founded this health plan. So because of that, existence in our DNA, it's really important to us that people really understand how all of these issues are going to impact their lives. So as we're talking about consumers and what their access to coverage could look like through the AHCA, we also really need to talk about providers and their ability to continue to afford to provide care to populations that are really in need. So the AHCA is going to impact them as well. Will impact their reimbursement, will impact their ability to continue to provide care to people. So both sides of that ecosystem are really important as they come together in partnership with the health plan to ensure high quality access to health coverage for people who really need it and maybe don't get coverage through their employer.
But we want to say important to note that if you're talking about the Affordable Care Plan, the Affordable Health Care Plan right now, that's Obamacare as we know it, that is still presently in existence.
Yes.
And I think sometimes people think that we've heard the news that Obamacare, or quote unquote, the plan has been repealed.
It has not, at least not right now. So there is lots of conversation about doing it. All that's happened right now is that the American Health Care Act has passed the House of Representatives. It's now in the Senate, and the Senate will make their own revisions to that act, and then there are a whole slew of things that will need to happen before that becomes law. So we're going to get another bite at the apple. We'll get another opportunity to talk about what's in this bill when it changes and when it changes again, and before it goes to the president for signature. So in the meantime, people should just understand what's in it. That's all we have to do, and have some conversations about what they think it means for them.
Got about 1 minute left.
Yeah.
Give me your final thoughts.
Sure. So people can get more information about this. There's tons of information about this out there on the web. Two places where people can go to get real good information is the Kaiser Family Foundation, or kff.org. And the other place that they can go to is Affinity's blog. It's affinityplan.org/blog. I have a fresh blog that's up there today with lots more great detail. We want to hear from people, understand what questions they have to ask. I'd be happy to bring those questions back here and answer them on air for your audience. So please respond and let us know what you think.
All right, Abby Adochi, thanks so much for coming and sharing with us.
Sure.
Abby Adochi, our guest here on Perspectives. This has been a Perspectives Web exclusive. I'm Darren Jaime. Thanks for watching.
What's on your mind?
Anything relevant to life, you bring it to the table. Whether you make a move solo or a movement with a stable. No fables, you speak on your decisions. Cause in the long run, it's your voice, your views, your vision. Keeping it real with many messages for you to know. This ain't radio, but DJ runs the show. Entertainment, he rocks it.
Coming to you from our BronxNet studios, 4 new shows highlighting some of the best of the Bronx has to offer. We sit down with political leaders on In the District and discuss local legislation, events, and issues. See how the community and business come together with The Bronx Now on BronxNet. Nosotros features leaders from our Latino community. Meet those who are moving to make a difference in public service, business, arts, and culture. Looking for new and exciting dining experiences? Then you'll want to savor the Bronx and try new restaurants and eateries that fill the borough with delicious dishes. We have it all, so experience the Bronx in new and fresh ways on BronxNet.
We are together. And for the last 20 years, we have been building on a vision to share our views, our voices on our channels. We are the Bronx. We are BronxNet.